So we have planned it again today, hoping that many people will take the advantage of this class. So today the same class will be repeated along with the addition of syllabus overview by BhagyaShree. Again, she is a working pharmacist in Dubai. So she is registered pharmacist in Dubai and she is working there. And BhagyaShree and Swapna, they both will be helping us in terms of processing, classes planning, everything. And Jyoti madam will take care of all the academics plan, everything. So this is a complete interactive kind of session. Whatever queries you have related to Dubai pharmacist career opportunities, or maybe a DHA exam, all those things, you can get clarify all the things. But the basic thing to get into Dubai as a pharmacist is that you need to have minimum of 2 years experience and you should be registered with the pharmacy council. It can be of any state. They will be seeing the registered pharmacy certificate. There, on the back side of the registered pharmacy certificate, they will be mentioning your working experience there. Where is the pharmacist you are working, which place. So if you have these two requirements, 100% you can go for the Dubai with the DHA exam. This is the minimum eligibility. Coming to salary part, even I have my personal. And it's a high valued profession in other countries. In India, they are trying to do their best. Still, it's in process with the new PCA president, Mr. Montu Kumar Patel sir. He has bringing a lot of reforms in the PCI, especially to improve the pharmacy of the world. So let's hope for the best what may happen in future. But today the discussion is pertaining to only for the Dubai pharmacist career opportunities. How to write this DHA exam, what will be the syllabus of that, and what is the process it will be taking, all those things. Swapna will be taking care of, and Bhagyashree is joined with us. She will be taking care of today. Okay. So if you have any queries, please don't hesitate to post it in the chat box. At the end, we'll have interactive session, question and answer session, where Jyoti madam will read out all the questions and Bhagyashree and Swapna will be addressing all the answers. So with this, I invite Swapna to start the session. Over to you, Swapna.
So in this presentation, I want to discuss about DHA, eligibility criteria, validity of the exam, and different steps that are involved to get a DHA license. So what is DHA actually? So DHA stands for Dubai Health Authority. It is an exam which is conducted for all the medical professionals to work in Dubai. So as all we know, the main role of the pharmacist is to ensure then coming to the eligibility criteria. So if minimum 4-year degree, that is like, you're audible, right? Guys, because someone said that it is not audible. That's why I'm saying. So it is audible, right? Yeah, done. See, coming to the eligibility criteria, a 4-year degree from an accredited college of pharmacy, that is B Pharmacy, M Pharmacy, and PharmD, or like eligible for this exam. Even D Pharm people are also eligible for this exam, but they can work as an only assistant pharmacist in Dubai. And next is that, and they should have a registration from the Pharmacy Council. Next, 2 years experience, that is, this is mandatory. A 2 years of valid experience should be there, either from the hospital or coming to the good standing certificate. See, good standing certificate, like you have to apply online. Okay. Good standing certificate you have to apply online, and you after applying the online application form, you can go to the pharmacy council and you have to pay some amount will be there, like around 5,000 rupees, I think. Like you have to pay that required fees for that. then Pharmacy Council will verify all your documents, and DHA also will review your documents after submitting by the Pharmacy Council. Once your application is submitted to the Pharmacy Council, then DHA will be DHA. They will do? They will review the process. Okay, what the documents, whatever you have applied online, they will review this DHA documents. So once DHA review is done, the good standing certificate will be issued, that is generated, a copy will be generated through email to the Dubai Health Authority. Next, coming to the pattern, like exam format will be in multiple choice questions, okay? And it is a computer based exam and it is not a written exam. And in previously, this exam format is completely different because we used to have for about 3 hours time for writing DHA exam. But now the time is completely reduced to 165 minutes for attempting 150 multiple choice questions. So after attempting this, so for example, if the it is like, for example, if the exam is started now, like you have to answer 150 multiple choice questions in 165 minutes. There is no negative marking for this exam. And as I said you previously also, and you should attempt all the questions, okay? And after, once your exam is done, the exam result will be displayed as pass or fail on the Shreyan portal within 2 or 3 working days, between 2 to 5 working days even. And the score will not be displayed, like whether like you got, for example, if you got 100 marks, for example, it will not be displayed on the screen. Only pass or fail will be displayed on the screen on the Shreyan portal. And the minimum pass percentage is 90 marks. So that is 60%. So coming to the validity of the exam, and exam is valid for 5 years, okay? And you will have 3 attempts to pass for the exam. If you cannot clear the exam with these 3 attempts, you cannot write the DHA exam. But one thing you can do, like you can write other Emirates exam like MOH, which in which like Ras Al Khaimah, Ajman and Sharjah. Like for that Emirates MOH exam you have to write. But if the DHS submit your documents to MOH, then your application, there is a chance of getting your application rejected. So better try to clear this exam on the first attempt itself, because it is like, if you work hard like for like 1 or 2 months, I hope so, like you will definitely crack the exam. And there is no age criteria for the exam. Coming to the exam center, so this exam is a worldwide exam and it is conducted worldwide over 160 countries in 8,000 test centers. And Prometric is the one which is going to conduct this exam, that is Dubai Health Authority exam, as I said you, DHA. And the centers that are located in India or in Kerala, we have 2 centers, like in Trivandrum. The other centers nearby are located in Bangalore, Chennai, Mumbai, Gorgan, West Bengal, Pune, Ahmedabad, and Hyderabad. In Hyderabad, I think like the only one center is there. It is in Gachibowli, Narakramguda. Next, coming to the steps involved to become a registered pharmacist. So what are the steps involved? What are the different criteria you have to meet with to become a registered pharmacist in Dubai? So as I said you, like you have to prepare with all the documents. I have already discussed in the previous slides, like what are the documents you require. Once the documents are ready, like first you create a Shreyan account. For creating the Shreyan account, you'll get an eligibility ID after creating a Shreyan account. It will take maximum 6 weeks of time. So once getting the eligibility ID, then you can start with the data flow process. So data flow process is nothing but primary source verification. Okay. So in data flow, the maximum time that is required to complete the data flow process is like 20 to 45 days maximum. So after you get the result, like either positive or negative from the data flow team, once it is done, you have to schedule your Prometric exam. Once the prometric exam is like you have to book a slot for prometric exam, and this prometric exam you can book a slot as your wish. So there is not a fixed date for this. So you can book a slot according to your wish. So once you clear the exam, definitely you will get the eligibility letter for DHA, and this eligibility through this eligibility letter you can book a slot for you can do visit visa and go to Dubai and start first searching for a job. So as I already discussed regarding the data flow, see it will take maximum of 25 to 45 days. So what is data flow? What is primary source verification? In this, the genuinity of the certificate is verified by the data flow team, and data flow team will keep an email or through a phone. They will contact with the HR department, and they will assess your certificate, that is experience certificate quality. I mean, they will inquire about the starting date of joining, date of leaving, everything they will inquire on the phone. Otherwise, they will directly visit the your work location, and they will verify the experience letter. So after once you get the data flow report has positive, then you can, as I said, you can book the prometric exam and get the eligibility letter, right? So this DHA eligibility letter is valid only for 1 year from the date of issue, and good standing certificate is valid for 6 months from the date of issue. So as I already discussed regarding the good standing certificate, how to apply and all this, so better to start first apply with the good standing certificate, because anyhow the time will be there for 6 months. This process will not take rather than 6 months. So first apply with the good standing certificate, because in the data flow process, the different documents that are verified are SSC memo, 10th memo, intermediate, degree certificate, registration from the pharmacy council, and experience letter, and good standing as well. So you should have this good standing ready, like before applying for the data flow process. So most of the people have a doubt how much it will cost to travel to Dubai, from India. This is the most frequent question we will get in the mind, right? So for that, it will cost within India, it will cost you around 1 lakh rupee. And after going to Dubai, it will cost, you have to carry a minimum 1 lakh rupee with you. So I want to explain in detail regarding this. So first, data flow. First, you have to start with the credentials. For creating the credentials, it will it will cost you around 220 AED, and for data flow 1500 AED. After that, you have to book a slot for prometric exam. This will cost you around 1100 AED. Once you clear the exam, then you have to apply for eligibility letter, which is mandatory. So for it, it will cost you 220 AED. Then you can continue the process, like you have to do with the process, and you have to book an air ticket.
I think she lost the connection. Just wait for 2 minutes. She will connect back.
Sir, any problem, sir?
No, carry on, please.
Yeah. Thank you, sir. Sir, so after going to Dubai, you have to do with your basic things, right? For 2 months. So for that, for food, it will cost you 300 to 500 AED, and for accommodation, 500 to 600 AED, and remaining expenses around 500 for approximately. So you have to keep minimum 1500 AED with you. So this is the cost that is required, amount that is required to travel from India to Dubai. Coming to the career opportunities. So we have number of career opportunities in Dubai, to be frankly speaking, because according to my experience now, we can search a job within 2 months, 2 or 3 months probably. It depends on our profile. and not only profile exactly, to be frankly speaking, based on the experience and luck even. So there are number of career opportunities. So Life Pharmacy and Aster Pharmacy, which are large group chains in Dubai, so they are conducting the Indian recruitment as well in India, in Kerala and Mumbai. For every 15 to 20 days, they are conducting this Indian recruitment. So if you get a valid job offer in India, then it's well and good. Otherwise, you can go to Dubai and on tourist visa and start searching for a job. So what is the difference between the hospital and the retail pharmacist? I want to discuss regarding this, because most of the people have a doubt like whether hospital pharmacy is good or the retail pharmacy is good. This is the most frequent doubt in our mind. So I want to explain in detail the difference between the hospital pharmacy and the retail pharmacy. So the main difference is that the salary. So the salary will be more in hospital pharmacy when compared to the retail pharmacy, as we know. And working hours are also only 8 hours in Dubai, like for hospital pharmacy when compared to the retail pharmacy. And growth is also good in hospital pharmacy when compared to the retail pharmacy. But the chances of getting hired, that is like in retail pharmacy, there is more chances to get hired easily when compared to the hospital pharmacy. But regarding the growth wise, hospital pharmacy is best. But for example, if you have a retail experience in India, you can get a job in hospital as well here. But there is a scope more for the retail pharmacy since you have retail experience. So as I said, you try to get an offer in hospital pharmacy. And the different portals that are required to search for a job, as I said you, or linkedin.com. This is the most very, very important portal. And LinkedIn, this is also, Indeed, sorry. Indeed is also one of the most important portal for searching the jobs. And the other portals are gulftalent.com, bait.com, laymoon.com, monstergulf.com, and naukrigulf.com. So try to, after coming to Dubai, try to start applying for the companies through these websites. You'll directly get a call from the companies within 1 or 2 weeks. And if you get the call, you can directly go to the company and give an interview. And if you after that, you can start working in the company. So coming to the salary, as I already discussed with you, the hospital pharmacist salary is between 4,000 to 6,000 AED. Approximately in INR, it is 1,30,000 per month in Dubai. So for pharmacist, like a retail pharmacist, it is around 5,000 to 5,000, 4,000 to 5,000 AED. And for assistant pharmacist in the sense the diploma holders, who is not having EsPharma and BPharma, even though they are, as I said you, they are eligible for writing this exam, and their salary is between 2,500 to 3,500 AED. And trainee pharmacist is between 2,000 to 3,000 AED. Trainee pharmacist in the sense you can work in Dubai without DHA as well, but the scope of opportunities is very less for the trainee pharmacist. So my sincere suggestion is try to clear the DHA and come through visit on Dubai and start for searching for the job. Thank you. I'm handovering to
everyone. So myself BhagyaShree. I am a DHA pharmacist in Dubai since last 5 years. And here in India, I was having the experience of almost 4 years as a hospital pharmacist. I have done my B.Pharma and I'm in MBA Healthcare and Management. And so here today we are going to discuss about what is the syllabus of DHA, which is a very big question. So we'll go through the slides so we can be having the knowledge about what is the syllabus of DHA. So moving to the slides, ma'am. Yeah. So as we know, in DHA, the major topics are like toxicology, biochemistry, case study, medical reviews. So here I will just give you the general idea what are the weightage of the marks from each and every topic. So we'll see like in DHA, syllabus is split into 10 major topics, which are like toxicology, which is generally around 5% you can say. Then pregnancy and lactation, which is around 5% again. Then in the pediatric and geriatric section, you will see 5% of questions are coming from that as well. Then pharmacy calculation and compounding, that is like 15%, which is having the good weightage in the questions. And then in the pharmacokinetic, it is 5%. Pharmaceutical care and disease state management. Here we see the percentage of mark distribution is very high, that is 35%. So when we will discuss further in the lectures, this section is very important to study because it contains about 35% of your total questions. Then the medication safety, which is like 5% of the questions. Then over-the-counter medications, which is contains about 10% of the questions. Then UAE pharmacy law and what are the pharmacy ethics, which contains around 10%. And the biochemistry, which is 15% percentage distribution in the questions. So this is the general knowledge. What will be the syllabus in the DHA? So these are the 10 major topics. So as Ma'am Swapna already have discussed with you guys that DHA exam pattern that contain total 150 MCQs, which you have to solve it into 165 minutes. Moving to next. So now the question will be, what is the content of the DHA exam? So here I'll let you know there are like major two part of the DHA. First part will talk about most of the theoretical aspect, your pharmacological knowledge, the pharmaceutical care, and the second part which will talk about more of your practical knowledge, the case study, case scenario. So the question will be like in two parts. One will be your theoretical knowledge and one will be based on your practical knowledge in the situation. So I'll just go through this. The DHA Pharma that covers wide range of topic related to your pharmacy practice, pharmaceutical science and the healthcare regulations. This exam includes in two parts. As I mentioned already, part 1 and part 2. Part 1 is a section typically consists of the multiple choice of question, which is generally of the pharmaceutical science, pharmacology, therapeutics, and pharmacy practice. The question may cover the topic as such as drug-drug interaction, the dosage form, what are the clinical guidelines, what are the scheduled drug. Like those questions will be there in this kind of questions. Then if you will come to part 2 of the DHA exam, so in that the more focus will be overall on your practical examination, your application to the practical clinical pharmacist in the Dubai. So it includes case scenario where you need to apply your knowledge to your real world scenario. This part assess ability to provide patient-centered care, communicate it effectively, and make appropriate clinical judgment. So this is about the DHA, what DHA contain. So that is what the exam is into the two parts. Part 1 will be mostly of the pharmaceutical therapeutic action, those things. And the second part will be your practical knowledge, every practical ongoing knowledge you should carry on. So that is the question will be in the part 2 of the DHA. Then further moving. So if we talk about in Dubai, the DHA pharmacist exam is very crucial step. So, when you are going for the DHA pharmacist exam, your knowledge should be appropriate and it competence in various aspects of pharmacy practice, like safety, well-being of the patient. Then your communication is also very well, will be appreciated. If you are communicative, if your communication skill is good, you will deliver your knowledge and you will catch the patient requirement very easily. That is all the agenda of the DHF exam pattern. Now moving to the next slide. So I will just give you the briefly knowledge of the DHA syllabus. like what we have studied in our B.Pharma or the M.Pharma. So the topics, the 10 major topics, what we are going to discuss here in further, like in the further lectures. So that is the first topic is the pharmaceutical science. Now in the pharmaceutical science, what we know is the pharmacology, pharmacokinetic, pharmacodynamics, then pharmaceutical dosage form, the biochemistry. So here I will just brief the terms like pharmaceutical science. This section covers the fundamental knowledge required for safe and effective medication management. So in this here, in the topic, we say pharmacology, that is a study of the drug action and their interaction and their side effects in the body. We have to study. Then pharmacokinetics. Pharmacokinetics, that is the understanding of their drug absorption, distribution, metabolism, and their elimination. Then here comes pharmacodynamics, that is mechanism of drug action on the body. Then we will talk about medicinal chemistry here, that is the chemical structures and the properties of the drug. Here like structure activity relationship of the molecule. For example, when you are saying salicylic acid, so here we will talk about their active ingredient, their active form, that is the isomer of the molecule. So basically we will discuss the important things which include in medicinal chemistry. Then here the pharmaceutical dosage form. Here we will talk about a different formulation like the oral, injectables, capsules, tablet. Those things we will discuss in detail further. Then biochemistry. In the first part, that is biochemistry, basic principle of biomolecules and their role in drug interaction. Here in the DHA exam pattern, biochemistry weightage is 15%. So we have to be like very, we have to give good, sorry, we have to give like good discussion in the biochemistry. So we can come to know, we can solve the structural problem and those questions which comes into the MCQs. So this is the first part of the DHA pharmacy syllabus. Then the second section in the same, that is pharmaceutical care. This segment focuses on patient-centered care, and the role of a pharmacist is in optimizing the therapeutic outcomes. So here we say patient counseling, that is very important. Your effective communication with patient regarding the medication they use, doses, what are the side effects and the precautions. So we have to have the knowledge of those things. Then the medication review. Comprehensive assessment of patient's medication regimen to prevent drug interaction and ensure appropriate therapy. Then the adverse drug reaction, that is a recognition and management of adverse effect of medication. And the drug information, that is the sourcing, evaluation, what is the drug related information we have to give to the patient. So this is all about the section of pharmaceutical care. We should get very good knowledge for preparation of the DHA. Then moving further, that is the clinical pharmacy. So here, as I mentioned, you have to deliver the clinical application of pharmaceutical knowledge. That is their therapeutic application, their pharmacokinetic. So therapeutic, that is the disease-specific treatment guideline and medical protocols. So here we will say like you should have the knowledge of the specific treatment, like the first line treatment for the antibiotics, second line treatment of the antibiotics, like those in pharmacology. Then clinical pharmacokinetics, that is applying your pharmacokinetic principle to individual medication dosing, like their distribution, elimination in the body. For example, if a doctor has prescribed the prescription, for example, he is saying, give this patient a saline of 0.9% and dilute it to the 20 ml and give doses like 2 times or 3 times in a day. So what we see here, that is a pharmacokinetic, we have to find out what will be the distribution, what will be the elimination of that particular drug. So this part particularly help us to solve the calculative part of the DHA. Then evidence-based practice, using research to guide clinical decision, like clinical decision where you have to mention whether it will be the IM, intramuscular or intravenous injection of the particular doses or particular drug. Then the further is drug utilization evaluation. Here, assessing the appropriate use of medication in a healthcare setting. Then drug monitoring is also important. Regular assessment of a patient response to the medication therapy. So this clinical pharmacy, what we discuss here right now, mostly helps you in the DHA exam questions in the case study scenario, like where you have to apply your therapeutic application for the for making the practical decision. So that is mostly the case study scenario, which is about the weightage of 35% in the in your exam. Then next is the pharmacy law and the ethics for the in Dubai as a pharmacist. So understanding the legal and ethical framework that governs the pharmacy practice. So we have to discuss and know the knowledge of the pharmacy laws and their regulation in Dubai. Familiarity with the laws related to pharmacy practice, drug dispensing and controlled substances. Then the professional ethics, that is adherence to the ethical standard in the patient care, confidentiality and conflict of interest. So mostly the pharmacy law and ethics in the practical pharmacy practical things, like we have to handle the controlled drug medication, semi-controlled drug medication. So here the laws and ethics we should adhere and we should be knowing as a DHA pharmacist. Then further moving, the next part is healthcare system. So this is the local healthcare system structure, regulation, roles of various healthcare professional. For example, as a pharmacist, if you are there in Dubai, as a DHA pharmacist, all the regulation and the rules you have to follow. You have to take care of your colleagues also, like no one should dispense the wrong medication at the time of the dispensing of the pharmacy. So if you are the in charge, you have to take care of all these things. So for that reason, you should be having the good knowledge of your handling the medication or the prescriptions. Then public health, awareness of public health initiatives, their vaccination programs, preventive healthcare measures, that also you have to be aware. Then research methodology, basics of research design, data analysis, their interpretation. This may also include understanding of their clinical trials and their phases. Like mostly if you are working in a hospital pharmacy, you will come to know about this kind of data analysis. You have to give your if there is any kind of clinical data trial is going on. So you have to be in this methodology and you should have this kind of knowledge to work in a hospital as a pharmacist. Then the communication skills. Of course, your communication skills with the patient should be effective and even with the doctors. So there will be no communication error while dispensing the medication and giving the knowledge to the patient. Then quality and safety in pharmacy. Principles of quality assurance, medication safety, and error prevention in pharmacy practice. So in the DHA exam, why it is much important? Because when you are dispensing the medication, if you have to be very well aware of the each and individual doses, their name, the spellings. There will be kind of, you can say, error you will find when you will work in the pharmacy. That's why when you're preparing for the DHA, you will find this kind of syllabus will be included. So you cannot do, the malfunctioning or the error in the pharmacy practice. So that is what we are going to study in the DHA syllabus as well. Moving to the next slide. The calculation parts. So the calculation part is also very much important in DHA syllabus, as there you will find like 15% to 20% of questions will be there from the calculative part. So the calculation part, say you can say it is very easy to solve it, as just you have to be of the knowledge of the formulas, and the tricky question you have to solve it. Like the answer will be in the front only, but you have to be having the good knowledge of the formulas and how to solve the question, so you can easily answer the question by simply checking the question. So in this accurate calculation of medication doses and preparation, the DHA pharmacist exam is comprehensive and demands a deep understanding of various pharmacy related domains. So you can see compounding and compounding in the pharmacy is also there as a part in the DHA pharmacist, as a DHA pharmacist in Dubai. If you are working in a hospital pharmacist, you have to do the compounding of the ointment, cream, or the dilution of the injection. So if you know the calculation, then only you can further proceed for the practice. So that is the why calculation has given much more importance in the DHA syllabus. Moving to the next. So if we say, what is the conclusion of your DHA exam? So mastering the DHA pharmacist exam requires your diligence, dedication, and holistic approach to the pharmacy practice. By thoroughly studying each aspect of the syllabus, you will not only succeed in the exam, but also be a better equipped to provide safe and effective pharmaceutical care to the patient in Dubai. So these are the brief knowledge of your DHA syllabus, what I just go through with the slide. So there are total 10 major topics as we have discussed, and we have to go in brief discussion of each and every topic. Like if I will give you the examples of antihypertensive drug. So when you are studying about the antihypertensive drug, you should know first what is the mechanism, what is antihypertensive, then what is the mechanism of the antihypertensive drug, and the classification, that is much more important. If you know the classification of the particular topic, for example, I'm giving you antihypertensive drug, you can easily come to know the multiple choice questions answer you can easily deal with. So when we will discuss about the topic separately further in the next lectures, so you will come to know how to compromise, how to comprehensive your knowledge to answer your questions. So if I will move further, I have given you some sample MCQs for the what comes in a DHA, what it looks like, and how you have to prepare yourself. So first example, if I will go to the first MCQ of DHA, that is here, it is asked the simple question, that is, what is the daily intake of vitamin A for the adult female? So the option will be there, that is A, B, C, D options are there. So the appropriate answer, that is just simple, is like for female it is 700 mcg. So this mcg, now the trick, you know how you can practice the DHA questions. Now in the only one question, you can create 10 types of further question. Like for the adult female is 700 mcg. If we will talk about microgram, then you have to just convert into the microgram, so you will get the proper answer. Then if I will say further, what will be the doses for the kids, what will be the doses for the male? So here you see, in one question only, when you are going through the MCQs, you in one question you can discuss 4 or 5 many things. So you can able to answer the details. So for example, if you will say what will be the doses of vitamin A for the male, that is like 900 mcg. Then the second question, what we discuss here, that is the diuretic which is used with captopril. Now captopril is one of the diuretic. So here the question is, along with captopril, which diuretic you can use it? So here your answer will be thiazide. So thiazide is the enzyme ACI inhibitor. So here also, when you are solving this kind of questions, here you can see A, B, C, D option. So when you are practicing for the DHA MCQs, you don't have to focus only on the answer what you are getting. You have to focus on all the options. Like, okay, what is furosemide? What is ethansamic acid? What is aldactone? That is the spironolactone. So when you will focus on each and every of the options, when you are saying furosemide, so it's a diuretic where we are using it. That kind of question should arise in your mind, so you can answer that even when you are not seeing the question. So further, in the third question example for the DHA, that is nitrofurantoin. Now nitrofurantoin is indicated for urinary tract infection. So here you can see the option A, B, C, and D. Now again, urinary tract infection, when you are knowing the answer, when you are giving the answer, you should thought about the other urinary tract infection treatment drug. So you can learn about, at one time you can solve 5 questions at a time by yourself. So that is why when you are preparing the syllabus, like when you will discuss about the topic, any of the topic, for say, urinary tract infection treatment drug. So you should be aware of the medicine which is available for the same treatment, like the antibiotic also which used in the urinary tract infection. So your interaction or when you're seeing the question, you should able to create and answer the 3 or 4 answers. So that is much more helpful in DHA, because the DHA, there will be tricky question also. You know the answer, but you have to just think little bit more. Then if you will say the next question, that is the calculative part, I just mentioned the simple one, that how can you prepare the 100 ml of 12% of magnesium chloride by taking the options A, B, C, and D. So here it is a simple calculation. As it is mentioned 12%, that is means 100. So there will be the answer will be 12 mg of magnesium chloride dissolved in 100 ml of water. Now there are like many of the options are there. To confuse you, like 12 ml if it is, 1000 ml of water is it, like those kind of you can say the options are there just to juggle yourself. So when you are going through the calculation, it's a very simple questions. You have to be just very tricky to pick up the answer. Then the next, the compounding one, the question is, you have the prescription where the doctor has prescribed the hydrocortisone, that is 2% weight by weight, and cold cream, you have to make the cold cream of 60 grams. So you have the hydrocortisone solution of 100 milligram per ml in your hand. And how many milliliters you will have to use for the solution to make to the cold cream of 60 gram. So there are the option A, B, C, D. And in the answer also, you can see I have mentioned the solution for the same. That is the present solution, what you have to make is 2% W by W. So 2%, you have to make it from 100 gram of the hydrocortisone solution. That means 2 grams. So this I am just giving you the brief description about the compounding, the calculation part. We will discuss this further in the further slides or the further lectures, where we will discuss about in deeply the calculative parts, compounding part, case scenario. So these are the DHA syllabus. The most people, they have the question, what is there in the DHA syllabus? So this is what is the DHA syllabus, which is compromising of your pharmaceutical knowledge and the practical knowledge. Thank you. You have any questions here?
Thank you very much, Bhagyashree.
Yeah.
So we'll take up the questions. Just I request you, please wait for another 10 minutes. Just
Yes.
before that, I would like to share my screen here. Just people want to know some details about the batch details.
Yes.
Yeah. So I hope everyone can see my screen here. Actually, we are starting the batches very soon. So we are expecting at least 30 people batch to start with. So as this is the first time batch, we will be having very much of monitoring each and individual students. So only thing is that you need to decide yourself whether you want to go to Dubai or not. That is the first criteria. Second thing is that you need to have 2 years of experience. Third thing is you need to have the PCA certificate with a good standing certificate. So these are the requirements. If you have decided to go to Dubai, then we are happy to help you out in every part of this thing. We'll be helping in the processing part. We'll be helping in the coaching as well. Bhagyashree and Swapna and Jyoti madam, 3 people will be with us, and apart from that, you will be seeing more faculty also. So how the demos happen today as a orientation class, the same thing will happen for the next 3 months. So daily evening classes will be there, and you will have access to all the recorded classes. We'll be providing all the materials. We'll be providing all the MCQs there, and the faculty will be NIPER alumni faculty and somebody who is working as a Dubai pharmacist. So we'll have all this kind of faculty, and we'll be helping in the, as I said, we'll be helping out in the processing part also, where Swapna will take care of end-to-end operations of all the processing part, data flow, all those things. And the fees for this batch we kept like 25,000 for the coaching. And the data for processing we are charging 5,000 people. But don't worry about the fees. You can call back us. You can just take a screenshot of this, and I'm giving my contact details of the institute. You can take a screenshot of this institute. So as and when you decide, please come back to us. We are much happy to help you out. As you have seen, the people who are already working there, they have done their efforts and they are doing happily there. So with this, just I'm closing the session with the question and answer session. Now Jyoti madam will take care of all the question and answers. If whatever questions you have,